So welcome everybody to the Soffer Longevity Podcast. Today we have a really special segment. We actually have what we call the man on the street. So we've gotten a lot of requests from folks and questions. And so we've invited one of our producers, Serge, who's going to join us today and ask questions that really reflect what a lot of you out there may want to know during what Dr. Maklad and I actually call our doctor's lounge, where we sit and kind of discuss things that are, being discussed in doctors' lounges and, coffee shops all over the country that are relevant for today. So that's the goal for today. So enjoy our Man on the Street Soffer Longevity Podcast. Also wanted to thank our sponsors, Longevity AI, for making this possible today. Okay, guys, we're here. Mm-hmm. We're going to discuss some of the events that are happening this week right now we're in the sort of end of May 2026 and there's some really interesting stuff happening and I want to get everybody's perspective from Dr. Maklad, who represents not only a board certified family practitioner but also a functional medicine specialist that will really give us her perspective, as well as we have Serge. So Serge is my inspiration for a lot of this podcast, a podcast specialist, but he's also an interested, I'm going to say middle-aged man that has questions about longevity and is very inquisitive and has been hearing from our listeners and subscribers that will reflect what their questions are. So I'm going to throw the topic to you guys. One of the things I did, a very interesting thing I did last night, I went to a great dinner with the founder, the CEO, and potential, I don't know if he's going to be a Nobel Prize winner, but certainly going to be an impactful scientist. His name is Dr. Kim, and he invented Clearly, which is the AI version of getting a CAT scan that looks specifically at the plaque burden on the heart. So how much plaque is the heart developing? So for years, and I mean a lot of years, we've been trying to look at how much cholesterol has been building in our circulation, how much even cholesterol is kind of coming into our heart arteries, but really what we're looking for is plaque. Plaque is building up and it's obstructing our heart arteries that we only have one heart, and if one of those gets obstructed, it's a heart attack or worse. So the AI imagery is allowing us to know about this plaque, and it's changing the way that we prevent things. We can see plaque a lot way before we can actually see blockages. And the vulnerable plaque, or those plaques that are likely to cause us problems, are being identified, and he did a lot to do that. So I have a lot to download to you about my really cool night, dinner with him last night. But I wanted to first sort of throw that topic out to both of you. I'll start with Dr. Maklad and her perspective on plaque and in general.
Well, can I ask you one question first?
Sure.
So what is your opinion between that and just getting like a calcium artery score?
That's a great question. So a lot of people have heard about these calcium scores, where you can get just a score of how much a surrogate marker, or what looks like plaque, which is in the form of calcium, is in the heart. And that was actually developed by a very close colleague of mine, someone who I trained with, Dr. Arthur Agatston, who's local, and actually it's called the Agatston score.
Yes.
And in fairness, there was two doctors there, and he got top billing, but I got to see him sort of bring that to life. And what they did is they took these, CT scans. They said, well, these have a lot of calcium in them. It turns out the ones that have more calcium might have more plaque and hardening of the arteries, essentially. And it turns out those people are at higher risk of having, blockages. So they started to correlate all that into a number. We know 0 is the ultimate number that you want. I just had my calcium score, and I had a 0 at 50 something. I'm now just turned 60, but it was a year or so ago. The surprises I've gotten from even people in their 30s when they come back and they get, let's say, a 400 or 500, which is considered high risk, is amazing. So the calcium score was the first insight into this imagery. And I think that what Dr. Kim has done is taken that to the next level. So now it's not just a general amount of calcium which sits in the plaque. It's the actual plaque itself. And it's not just the plaque. It's what is the plaque? Because we all kind of have certain amount of plaque in our arteries, which is vulnerable, which is likely like a pimple to open up and rupture. Yeah. So that's what he has been identifying, and he's a scientist at Heart. He's had multiple randomized clinical trials, and all of them show a very high correlation with disease. So the question is, and he poses this, shouldn't we be screening this with everybody? Shouldn't everybody have this? And then follow it over time, or start with having one, and then follow it over time.
So I can tell you with my patients, I do like to get a clearly instead of just the calcium score. So that's just my opinion.
I have a question. Sorry for being not so scientific, but is there an actual baseline for people of what is normal or not normal? Let's say, for example, for a person of Asian descent in their 30s, this would be normal. And for a person of like Norwegian descent or African American descent or African descent, this would be normal for their particular, because obviously diets matter, lifestyle matters, the genetics matter.
It's a great question. So I was sitting with a doctor last night at this. We had a meeting with just a few of us. It was in town discussing some of the scientific developments of clearly and this AI imagery for CAT scans of the heart. And there was a doctor who happened to be there, and the doctor said, listen, I am of Hispanic descent, and I have high cholesterol. So my numbers were significantly high. I want to say, LDL was kind of a loud room, but I want to think his LDL was over 200. His HDL was only in the 40s. And he was about 50. Not even 50. And he's like, I did a calcium score, and it was, drum roll,
Zero.
And he said, I've been told to be on statins for the last 20 years, and I, as a doctor, have refused it. Not only did I save the system, he had calculated like $50,000 in medication or whatever, but he's like, and look at me, I got a zero. What do you think about that? He actually asked that question to the pioneer of this, Dr. Kim. And I thought it was a great question. And we studied, this group in Italy that they were able to genetically analyze and find out there are some people that can have high cholesterols, but they don't get absorbed into the cells. They have a receptor problem that doesn't bring them into the cells. That's a very unique population, and they were able to look at that particular population. Happened to be in a blue zone. It was all around the same time, but nothing really to do with the blue zone. It was a unique family,
just a genetic anomaly.
Genetic anomaly. So he's like, maybe I'm one of those guys, and I go, or maybe
you have soft plaques,
or maybe you have soft plaques, or maybe you are. All of the three major things that kill us, so cardiovascular disease, neurodegenerative disease like Alzheimer's, dementia, cognitive impairment, and cancer, they all take roughly, not all, 20 years to develop. So I said to him, well, you have cholesterol we know is bad. We know over time is bad. Do you want to wait to see calcium to start your anti-cholesterol treatment?
Yeah.
With what we have available, and that always gets better. It gets more and more personalized. So I think I convinced him to like, great, it's zero. That's where you want it, buddy.
Yeah.
You want it to be zero. We want it to be, no matter if you're Scandinavian, African, you want it to be zero. That we're born with a zero, a calcium score of zero. We're not born with plaques. We've got these fresh hoses that are feeding all of our tissues. And as time goes by, they, for a variety of reasons, will harden. If they do it slowly, it's probably okay. Those are not vulnerable plaques, and that's what we spent a lot of time talking about last night. There's actually plaques that are less worry than others. And you want to make sure that if you have some calcium, if you have some plaques are the right type of plaques. So now we're talking about like good plaque versus bad plaque, not just good cholesterol versus bad cholesterol, because that's really a surrogate marker for the actual plaque that you're looking at. You're looking at you want to have Not only do you want to have zero plaques, but if
Yeah.
you're going to have plaques, you want to have good plaques.
Yeah.
But
So-
what causes the good and the bad? I think that's what most people, because you could say all you want, bad,
Yep.
good, but what do I do to cause the bad to appear, and what do I do to cause the good? Like,
Great.
Well, you
So-
don't want any plaques. I think that's
well, or that, yeah.
Yeah.
So, like, what actually is the cause? Is it the lack of movement, or is it particular foods that have a higher capacity to cause the plaque versus other foods? Do some foods clean it out?
I would say there's multiple. Those are all very valid.
What are the main ones?
Well, let's
Like,
start with
what's the
picking the
top
right
3?
parents.
yeah. Could you do that?
So genetically, that's an important
Mom, we got a problem.
Well, we have a test for that now. The LPA really tells us the genetic component of that. And it's only 4 out of 5 are fine. 1 out of 5 has the genetic component. 4 out of 5 is lifestyle. So 4 out of 5 is all of those things that you just said. So the Mediterranean diet seems to be the best one. The exercising 150 minutes a week of some sort of aerobic activity seems to be the best type. Not that resistance training isn't very important, but maybe not as much for cholesterol related or plaque progression. Then of course, sleep. Enough
Heard of
sleep.
it.
Read
about it.
remember that? Yeah. No smoking, insulin, all of the biomarkers that Dr. Maklad is doing with her now plethora of including vitamin D levels and there are more and more things that all combine towards it. Each one of them has a treatment. It looks like even the genetic thing, which is Lp(a). I know because I happen to be a principal investigator on one of the major studies for people that have LPA and are trying to reduce the risk of that. So we will in our lifetimes. I don't think we'll be dying of atherosclerosis. I don't think we'll be dying of heart attacks and strokes, which right now the number 1 and 2, the number 1 killer is MACE, so major adverse cardiovascular events, it's heart attacks, strokes, things like that. I don't think we'll be dying of that. I think that if we also advance the other two, we're all going to both live longer and live better. I'm not saying we're going to live forever. We're not trying to live forever. We're just trying to be welderly, not elderly, welderly. That's the goal of Soffer Longevity. That's the goal of this discussion. It's really all of our goals. So, yeah.
So what do I not eat? Let's say just for the random person, what are the top 3 foods that cause the plaque that you should cut out if you possibly can?
Well, processed foods, I think that would be like number 1. So sticking to a whole foods diet. So you're not eating things that, nature did not make.
If it's packaged, don't eat it.
Pretty much. There actually are like good packaged foods and non-good. So it's just try to stay. Like if it has a label, probably don't eat it.
If it has ingredients.
If it has, the ingredient list is like, 15 things long and you can't pronounce them.
Yeah.
Probably best to stay away from it.
Okay.
And then, let's see, with other types of foods,
Out of Whole Foods, for example.
like your fish is because you get your omegas, so the omega-3s are incredibly important. So eating fish, the smaller the fish, the better, just because of the mercury in them. So sardines are a really good one to eat. And then your vegetables to get your nutrients and fruits.
But what do I avoid except for the processed foods?
food, mostly.
Out of the Whole Foods, is there anything that causes plaque buildup?
Not that I can think of out of Whole Foods.
Dairy?
Well, listen, I think that this is where it gets pretty intricate, where Dr. Maklad is holding back properly a bit because it's person dependent. And you really...
This is exactly why I was saying about the plaque.
You need to have a real... It's not a one-size-fits-all situation. And that's what's... Medicine 3.0, if you will, is basically precision medicine. So we got to look at all of your blood markers, including your microbiome, so including the way your bacteria in your gut actually change them, because they take everything that we eat and they alter it. And so we have different genetic predispositions to that. We have different environmental predispositions to that. So I do not think that we can tell one person to eat a no red meat and the other person to eat only fish. She is correct that fish in the diet, the omega-3s that come from that is extremely beneficial. And if you don't get fish in your diet, then you should be supplementing. Or you may get fish in your diet and turns out your microbiome and your body doesn't absorb it well enough. I had the most interesting thing we did my testing recently, and I, as you could probably tell, I don't know if the audience can, they definitely can't hear it, but if they can see me, I am tan.
Yeah.
And I'm tan because I have this terrible obsession with pickleball, and I'm outside a lot, and I get a lot of sunlight. And I'm a pretty big-boned guy. I like to eat. So when I found my vitamin D was low for the first time in my life at 60, it just clicked in me that we are absorbing things differently, not only as each individual does, but we're absorbing it differently over time. And maybe it's not just longitudinal time, which is like the older you are, the probably less likely you're going to absorb things well, but how about stressful times in your life where you're maybe eating fine, but you're not absorbing well because the stress changes your pH, and all of a sudden your diet is different, then your sleep is different. So working with a functional medicine specialist, which I am not, Dr. Maklad is, she is a functional medicine specialist, is able to take those the functions that we're actually watching with blood tests and objective parameters, not just blood tests. It could be genetic analysis. It could be, exercise testing, VO2 max, there's a variety of things that she uses. But then adapting that to the individual is the thing that could answer your question best. In other words, what can you eat or not eat is an individualized thing. There's a lot that goes into it. We've all we've all read the books, but it's really her ability to deal with the individual patients over time to see what is best. And yeah, she does confer with me as a cardiovascular specialist, so I tell her what we're learning, but then you have to adapt it to the individual.
Like a CGM gives you the continuous glucose monitor, just gives you so much information on what foods your body is fine with and what foods your body does not like.
My wife just now started a CGM that she bought over the counter just to see what's happening.
What?
And
they sell it on Amazon.
Yeah. We found out that she might be pre-diabetic. She's super lean, muscle, works out, runs around. She ate a candy bar, and her blood sugar went to 200 and stayed there for almost an hour and a half.
You're kidding.
No, and it stayed there, and all of a sudden it dropped to 86.
Oh, wow.
Caught itself up, and then went back up again.
So the question is like, what is her hemoglobin A1C? What is her insulin level? What is all these other factors?
Of course. But we were shocked, like how long it took. It was almost 2 hours. She sent me the graph. I was like, this is impossible. So she pricked her finger, and it matched exactly.
So 2 Nobel Prizes, and I don't know what the criterion is for Nobel Prize, and I am definitely, I don't think I'm in line for one. Although I'm going to get a Nobel Prize, but a Nobel Prize probably isn't in my future. But I will tell you 2 people that should be considered for it. One is whoever, and I don't know who it was, but that democratizing the CGM. I did my glucose monitor, and I got to tell you, it changed the way I look at all foods, changed the way when I exercise, how I exercise. It was such an easy thing you got me to do. Happened to be like, listen, I was blessed. I was here. There was a rep. Let me just put it on. I was like, you're going to stay. I thought it was going to hurt. Didn't hurt. The whole thing was so easy. And then if anything, I was getting too much information. In the middle of the night, it was telling me, you're 90, or 80, or 70, whatever it is. And I started to learn about myself and how I metabolize things. And you know what? That is super important, particularly at a particular age. I don't know if I would have done anything with it in my 20s and 30s. But certainly my late 50s, I guess, when I did it, or was it, late 50s, it was amazing. And look at you with your wife, that you guys might have added decades to her life by understanding that early. If you are able to capture this and stop her from actually progressing towards diabetes, which Dr. Maklad is amazing at, using functional medicine to stop that. Doesn't mean necessarily even medications. It could mean changes in her particular precision diet and things like that. So it's good for you.
And it goes back to the individuality because my kid's a type 1 diabetic, we almost exclusively eat healthy food and keto. And she doesn't eat sugar that much, and once in a while she'll have like a little square. She just wanted to see how the CGM works, and that's how the whole experiment happened. But lean, sporty, eats healthy, everything's perfect, and we're like, how the hell can you be type 2? Like you did nothing because, obviously they call it lifestyle diabetes. And she does absolutely, like, of all the check marks for type 2, she does none of them. And we're like, what the hell happened? So it's just interesting how, individually body works and, how it gets affected by different things. If I may ask, let's say, for example, I'm 47. Most people that are in business or have their own practices or they're just working and they're just like, going through the cycle, wake up, go to work, come back, go to sleep. What would be like the protocol for us to start? What are like the easiest things? Obviously sleep. Forget about that. Without sleep. I understand it's super important, but so what are the top 3-4 things that will get you at least halfway there? Obviously, we all want to be on the Mediterranean diet. We all want to rest. We want no stress life. We want to sleep, but not a lot of people can do that. It's not realistic. So what are the most bang for your buck things that you can do, at least to start your way?
I would get tested.
Okay. No.
First thing.
100%. Yeah, that's what I mean. Like, what are the best things?
Yeah, because then that way you're getting tested. You know what you're trying to do.
What changes will change. You're likely not to have, almost independent of your age, sex, parents, whatever, you're likely to have some elements in this expanded testing capacity for functional medicine testing. So it's, your particular vitamin levels, for instance, obviously your microbiome, which seems to be very, very important. I don't want to get too deep into the type of genetic and epigenetic, but there's testing we do.
Yes.
So you do the testing. Obviously, take a very good intake. And then if you're asking us for the most common kind of, lifestyle-related changes, let's go through that a little bit. So the first thing, we can actually go through a typical day of how we recommend to the typical patient, which, again, we're moving away from the precision stuff. I think it's very important that every person has a functional medicine physician, a longevity plan. Do you know that people spend more time planning their vacation than planning how they want to live the most important part of their lives, So I think you take a minute and you go, this is how I want to live, this sort of the advancing parts of my life. You don't have to be old, just this is how I want to live longer, because remember, it takes 20 years for all these things to develop. So you got to start now, no matter almost what age you are. You got to start now to live properly. So, all right, so let's just kind of go through that for a second and say, you want to go to sleep at the same time, wake up at the same time, irrespective of, this whole, weekend, it really shouldn't matter. Your body does not understand weekends so much. It understands circadian rhythm. It understands sunlight. So the first thing you do is, if you can, you get up and you see some sunlight. So there's an idea of like, you open up the drapes and that begins the cortisol. There's reasons that this is not designed for. This is designed to be the man on the street. So I'm not going to get too scientific on you, but the first thing you want to do is get, wake up, try and wake up around the same time, try and get cortisol. So that could mean like a drape that's on a timer, for instance. And that's, maybe we'll go back and forth. I don't want to manipulate the conversation too much. So start up with sunlight.
Yes.
What's the next thing you would recommend? The average, typical, Joe human or
Water.
Josephina human.
Water. Okay.
First thing in the morning.
First thing.
Cold or warm? Because a lot of people, they say like lukewarm or like, what's the best?
Well, I think cold water just kind of like shocks, the system. So I think just drinking lukewarm water just kind of eases everything. It's it's not like, oh, geez, I just drank a super cold glass of water and my GI tract doesn't know what to
I've
do
heard
with it.
from a lot of people, when you drink water, to put maybe a tablespoon of apple cider vinegar. Does that do anything at all, or it's like hearsay?
That would person dependent.
Okay, fair enough.
And so that would be like my first steps is to drink an adequate amount of water in the morning before starting your day.
Okay.
Then if you could exercise.
Well, it's it's like a lot of people don't necessarily think that's maybe I want to exercise later in the day. I am 1,000% with you in believing that exercise before I think you have to earn your food.
Yes, exactly.
Right?
Exactly, because you're fasted. That's
Okay, fasted exercise, perfect.
Yeah, that's the perfect start to a day.
What type of exercise?
Well, some people just do from like resistance training to like yoga. It really is just the movement. It doesn't necessarily like you don't have to go run a marathon, but it's getting your body moving in the morning.
Asian cultures, obviously, a lot of them have Tai Chi that's done in sunlight, and with immediate, guess what? Socialization.
Yes.
Because without socialization, we're not isolated beings. We are sort of bred to socialize and to be around others and to not experience isolation or loneliness. So one of the first things, if you eliminate by some sort of whether it's yoga or you go to a gym that has a person or two in it, that seems to actually, those connections seem to help our cortisol, antidepressive, would then get you to exercise a little bit more. So now you've had a little bit of sunlight, you've woken up at the same time, and you've socialized. And you're now probably better than 99% of the people listening right now. And that's a good start to the day. We haven't even gotten to like 9 a.m. really.
Yeah, exactly.
So we don't have time in the podcast to do the whole thing. But that's a great start to your question. I don't know if that's the pathway you were thinking, Joe on the street.
Yes, absolutely. I just think like, a regular person, like what the doctors say that these are the most impactful things that I can do. Some are, okay, obviously you want more exercise, you want this, but like what are the musts that give me the most impact?
I will tell you that I combine on that exercise thing in the morning, which I've done fasted, and I'm fasting at least 3, usually 4 hours before I go to bed. So I'm getting at that moment, say I've gotten 7 hours sleep, 4 hours before I have an 8, I'm at 11, 12 hours. I only need about 4 more to get the 16-8 of my fast in. And that means just skipping breakfast. Now I have plenty of water. I personally am caffeine dependent, so I'm going to have a cup of coffee. 1, not 10. I have 1 cup of coffee. It does it for me within.
I think if I could get an IV, I would with the coffee.
Well, within 3 sips, within the sunlight and a little water and 3 sips of coffee, I feel terrific. I actually add a little bit in the interim which is, I don't think this is again a precision thing, not for everybody. But I enjoy psyllium. I have a little Metamucil in water. It reminds me to take my water, plus I get the psyllium husk, the fiber that comes in right out of the shoot. It also curbs my hunger a little bit. I don't feel like I'm missing out, and I get a little orange taste with it because they have these orange tasting ones. For me, that works great. It's pretty darn natural. And that's been a consistent thing that's helped my general digestion. That's a person-to-person thing. I wrote it in one of my books early on, so I know that's not for everybody, but it definitely works for me. And it makes my fast that I'm going to get to till noon work out. I also do some resistance. There's a lot of discussion about the need for resistance exercise with the aerobic exercise. So a lot of people will do whatever it's Tai Chi, yoga, go for a walk or run, swim, what have you. I definitely feel differently when I strain my muscles a little bit because it only takes me about 10 minutes of resistance training. I have a little bit of a home gym, but a lot of people can just do push-ups and pull-ups and those kind of things, little hand weights. That contraction of the muscle does an enormous amount to both keep the muscle, strengthen the bone, and I think it's also a good way to kind of wake up a little bit and have that in the feather in the cap before I go out to my day, where I may actually go to the gym at some other format, but at least I got a few minutes of resistance. So you kind of check those things off before I get going. What do you think about that, Dr.
Yeah, I think
Maklad?
that's a perfect way. I had a question for you.
Yeah, sure.
Okay. How about you do a little experiment? Okay. Do you usually drink coffee first?
I was actually about to ask, should you drink coffee first or should you drink water, wait, and then the coffee?
That's the question. So
Yeah.
I think I would like you to experiment. So your usual right now is that you drink coffee.
I actually do drink a glass of water while I'm making the coffee.
Okay.
Which isn't really that much time.
It's not that much time, but yeah. But
what would be a good time to have between the two of them?
As long as you're drinking that amount of water, I don't think it doesn't matter. You don't have to wait a certain amount of time until you have your coffee, but you're getting the water in first.
Yeah. Always.
Yeah.
I could try it the other way if you want.
Well, that way, I just want to see how you feel.
Well,
The
isn't
thing
that
is-
neat? Isn't that neat that she intuitively asked that because that is what she's also saying to me. Anyways, she's saying this is not a one size fits all situation. So she's asking you, why don't you see which way works for you? And I've seen her do that with a variety of different things, like, should I be taking in a different situation, my aspirin every day, or maybe try it every other day, or am I taking my vitamin D every day, every other day? We are not all the same beings. We're made up of millions of cells, if not trillions, and we respond differently, and respond differently over different times of our lives. And little adjustments like that might make a big difference for you.
Okay, well, I'll try both. But I think I'm not addicted to caffeine. I'm addicted to the taste of coffee. I'll eat coffee gum. I'll eat coffee ice cream.
You just like the taste of it.
Yeah, and it was since I was a little kid. Back when I was growing up, we had coffee gum, and it tastes kind of like Chobani. They have the coffee yogurt.
Oh,
Yeah.
I've never heard of coffee yogurt.
Yeah. If you go to like any store like Chobani, they
Okay,
have a
gotta look
coffee
at
flavored
that.
yogurt. Actually, Haagen does also.
By the way, if you're asking me if there's one food that I could recommend that I do know from, I like to look at everything evidence-based. One food that I could tell you, other than fish, that is better for you than almost anything else is, no sugar added Greek yogurt.
Yeah, just regular yogurt.
Regular
Regular
yogurt, not with all. They cannot have all the stuff in it. Cannot have all. Can't be yogurt with peanut butter and jam in it. Which is delicious, by the way. But the Greek yogurt has been time and time again shown to be so good for so many different parts of us. Why that is debatable, but the food stuff itself, if you can tolerate it, if you like the taste, if you can tolerate it, that's like the one go-to that I always try and add to my day.
It's the whole idea of the fermented foods. Yeah.
Okay, so we got our blood test. We woke up. We looked at the sun. We had water.
We had our water.
We did our push-ups.
We did some coffee.
We did some coffee. What's next?
Go about your day.
We're good to go.
We're good to go.
Okay. Day is done. We're home. Is there like winding off, kind of like winding down?
I wouldn't
kind of
have
thing?
dinner right, because some people do have very, very late dinners and then they go straight to sleep. So that's probably not the best idea. So to give a 3-hour, at least 3-4 hour window before falling asleep, because then you've digested.
What happens, because I know quite a few people, and it happened to me a few thousand times, where I come home, I'm super tired, I haven't eaten half a day, and I'm about to go to sleep, and I'm like...
I just eat whatever.
I just kind of stroll into the fridge, pile on...
Whatever you're hungry at that point.
Yeah, and like, how do I stop myself from doing it? And if I can't... Well, actually, no. How do I stop myself from doing that?
It is trying to make sure that you are eating during the day, because I think that's what the problem is like you go.
Yeah.
You forget to eat. And then by the time you come home, you're starved.
I tell you what worked for me. It was a form of hypnosis. And I'm not I've been to a million of those like hypnotic shows, whatever, hypnotists, and it's never worked for me. Like I don't think I'm sensitive to that. But what I did do, I want to do this intermittent fasting thing. Well, the hardest part of it was after dinner, stop snacking. You got a full refrigerator, I'm blessed to have, some good stuff that family makes. And so I sat with myself, said, okay, how am I going to do this? Because this is my critical period. I could push away a little bit of the food. I could so done with dinner, made sure that it was pretty much as soon as I came home, so that I did have that 3-hour window before actually hitting the bed, a cool, dark, 69, 68 degree bed room with no blue lights, no lights, around the same time. But what I did is I sat and I said, I like a little bit of tea at night. They have some of these,
Herbal.
herbal digestive teas. So I had a little bit of tea. Actually, I have a little mint leaves growing outside, so I take a little bit of the mint leaves. Felt that was good. But I said, when I'm done with this tea, I can eat whatever I want before the tea. But I knew I was going to have the tea 3 hours before I was going to go to sleep. So that I would literally like close my eyes and go, once the tea is done, you're done. Once the tea is done, you're done. And was I snacking with the tea?
As
with
he's
the
looking
tea?
at a giant cheesecake.
No, listen. I would have the cheesecake with the tea. I'd have a piece of the cheesecake with the
Like a
tea.
gallon of tea. Making sure.
2
gotta
o'clock
make it
in the morning.
last.
Yeah. So I would try and finish with that regular glass of tea, whatever. You know what I really liked was a little graham cracker in it, whatever. Like that was it. That little bit of discipline cut out 500 calories. Not only cut out the calories of the snacking, but it also caused me to want to go to bed on time because I knew I couldn't eat. I don't want to stay up late and eat. And it also caused me to, by that caloric deficit and not just having eaten, get to REM sleep quicker. I had better deep sleep because I wasn't eating closer to that time, which then you wake up better rested, not as hungry. Like it just sets up those little things, set up the patterns. And that's where she gets into this history when she spends an hour with somebody and really gets, when do you do. And then you make your decisions from there.
I think going to what you're saying, if a person does something hard, for you, it might have been not eating after tea. For me, it was like a physical thing. So I went straight to CrossFit. I'm not saying everybody should do it.
That's not easy, but it's great.
But the psychological factor of after that, I would see like pizza or I would see this. And I'm like, I almost freaking died today.
I deserve this.
No. It was the opposite.
The opposite
Is it worth sabotaging the pain I went through to get to a certain goal with this pizza? And it was the mindset shift that actually got me to lose, like I went from 203 to 170 in 3 months.
That's amazing.
I wouldn't eat bad food. I was like,
I just did all this
suffered
work.
I suffered way too much to like just throw this away.
A lot of people think actually the opposite. Like once they're
I
done
think,
with those,
no,
they're like,
see,
I deserve
this. This is the thing. Like when you're doing CrossFit, if you're doing it right, like everybody like goes, oh, you're just staring at the ladies' butts. I'm like, come with me one time. And at the end, as they're doing it, and they're like trying not to throw up, and I'm like, what was your thought? Just another step. Just another step. I'm like, you didn't see any butts?
Nope.
Shut up. Leave me alone. Just another step. And they run out. So when you're doing something truly hard, I don't mean you go to the gym and you're kind of like, you know what I mean? That suffering kind of puts in perspective, like, what else can I do to reach my goal?
Okay.
Well, all of these discussions do remind me from what we started out at the beginning, which is, the discussion of this calcium buildup. Right? So we know that stress, we know that inadequate routines can lead to this calcium buildup. And remember what that guy said. He said, listen, my calcium is 0. I don't need to worry right now. The future of medicine is not going to be any longer finding disease or, for that matter, finding disease and reacting to disease. It's going to be preventing it in the first place. And that is what we're talking about, these lifestyle patterns that are preventing it from happening. So, if I could wrap everything up in a bow, we want to make sure that everything that we're doing both in this longevity podcast as well in our lives are not contributing to disease, working towards reversing disease, and maybe most importantly, preventing it from happening. So without trying to seem too specific towards our sponsor, I only know one way right now of keeping all this straight, and it's this book about you that, again, right now, no financial interest other than we appreciate their sponsorship amongst others, but Longevity AI is putting all of this information, including the lifestyle part, including all the Fitbit and Apple Watch and Whoops and, I like to have one glass of water and not two, and all these things go together and have to be accumulated into one data aggregator. And then we add the traditional information. What is your hemoglobin A1C? And, these other bits of information. What does your colonoscopy show or doesn't show? And your CAT scan show or doesn't show? And especially your CTA now with the Clearly AI that can say, the plaque's starting and are they vulnerable and are they getting worse or better? All of this stuff has to be into something, physical something. Now mine happens to be in my app. This is an illustrative purpose. So I have an app that, and every once in a while I check in, and I don't perseverate. I don't make my life about it, but I do plan for it. Just like I plan for my upcoming vacation, I want to plan for the healthfulness into my future, and that I do with Dr. Maklad, luckily as my longevity doctor, as my and I wish that for everybody. I hope everyone can find someone that cares enough and that can find a data aggregator like this particular company that happens to be one that's leading the pack, but there will be others, and I think it's important that everyone has this ability to watch it over time.
Regarding longevity AI, do you have an actual real-time view of what's happening, considering it is reading your Apple Watch and all of your markers? Or do you have to go in and have it read everything once a month or once a week?
You have to, at this point, look, they do have connections to a variety of different what are they called?
Your wearables.
Wearables.
Yeah.
So there is they do have an ongoing group of connectors. Whether or not they connect live to it, I've not heard that, but I know that they are able to take it effortlessly into their platform and then integrate it. Then it's an LLM that they call Florence, and Florence does a great job of then integrating it into a readable format. Or on my app, I have the same app, so it and therefore if I'm having I'm having some really bad, GI symptoms every time I eat, my cornflakes or whatever, and it'll look at it's going to look at my book about you, and it's going to say, okay, for you, this may be a problem because it turns out your genetics don't do well with gluten or whatever. I'm making up something, but it's looking at the totality that is you, that you've inputted, right? And the input starts with a clinician asking you questions, you filling out an intake, your data that comes from your genetics, your epigenetics, which is what your genetics is methylating and turning into active stuff, your regular labs, your microbiome, your CT and CTA with Clearly, all of these tests. And it goes, okay, I understand who you are. It's almost impossible, if not impossible, for any single physician to keep that in their mind, even if they're giving you the full hour. They're going to need this. So this is going to be, there's actually a thing called a digital twin that they're working on, where you're going to make a virtual version of yourself and then test it for things. So this is basically the beginning of it. There's people go, I never want that because, it's going to be,
too much.
Yeah. But if you want to have this HIPAA protected capacity to have all of your information at a baseline, I think it's going to be one of the most valuable things you can do, even if you're healthy, because then you have that baseline. And what better to know that your baseline? Let's say you have an issue. I'll give you a great story. When I was in my residency it's at Cedars-Sinai in 1990, I was very taken by an article that said that the most important thing we can do to save a person that's having a heart attack is what? Now, take us back to 1990. What do you think the most important thing might have been?
Bed rest.
You'll never guess it. I'll let you continue to guess. But that was actually the treatment.
Okay.
The most important thing you could do is have your last EKG available. So they said that people that came in that had a previous EKG, because you could see the difference of what was happening during the heart attack.
Oh, because you have a baseline to start from.
Exactly.
Yeah.
So right now, that's why I did my whole body MRI. Not because I was looking for an incidental finding or did I think I had a problem. Is because I wanted a baseline.
Yeah.
Because a few years down the road, if there's some issue, they go, oh, look at this change.
Take my blood.
Take your blood right now. Okay.
So those are some of the doctor lounge hacks that we really do believe in. There are people that say don't get a whole body MRI because you'll find these incidental findings, and I understand where they're coming from, and you got to be careful with those incidental findings. But
what are the downsides of incidental findings?
You start going down a rabbit hole.
Oh, you become a Google Doc. You're like, oh my God, I got symptoms for everything.
Well, you start chasing things. So that's kind of the downside.
Yeah, but if
you have somebody
if you're with a doctor.
Exactly.
Oh yeah, no, I'm not saying read your own MRI.
Yeah.
even the doctor might be compelled. They may find something. I had little what I call lumpy bumpies on my liver and lumpy.
I got one here.
There? Okay.
Yeah.
Yeah.
For
Okay.
like 6 years.
Right.
They said I was just fat deposit.
Right. So imagine you have one of those in your liver and you're not really sure what it is before you're not getting a liver biopsy, and the liver biopsy gets infected, and there's these rabbit holes that populations go through. I didn't do it because I wasn't going to chase anything unless it was like something that just I missed.
Yeah.
I did it for a baseline because I want to know what my baseline looked. I could afford it. It wasn't that expensive. It wasn't difficult to do in the right place. It can be difficult to do if you do it in the wrong place. You can be on a tube for too long. But I was in a place that was pretty quick. They had some good music. I was kind of in and out. It took about an hour.
If a person wants to do that, what would be their, how do you physically do that? Do you just go to an MRI place and get...
No, a physician needs to order it, or a provider needs to order it. Yeah.
Okay, let's say your physician is saying, no, you don't need this.
Ask them why, and if you're not comfortable, change a physician. But you can find a physician that will say, okay, we'll do this. We'll write you prescription. By the way, this is for an MRI that just does not have any radiation. They work by magnets, right? So you're not getting any radiation. The tube itself, they're bigger and bigger now, so they're not like they used to be where you get claustrophobic. I will tell you that I did go to the wrong one first, famously. That was a little too small, and I was asking my brain also to be done, because you can actually detect and have a good baseline and get a brain age score with the new software out there. So I really wanted to do that. Thankfully, it was good. But I wanted to do that, and the tube was a little small, so I went to a bigger one. So you can do all these kind of things. Hopefully your doctor, a longevity doctor, usually is more accustomed to these kind of questions. It is typically it's not covered by insurance for general, but it wasn't that expensive. It was under $1,000. And I found it to be both very interesting, very reassuring, and mostly I feel like I got a baseline.
Awesome.
You could also tell things like visceral fat, as well as a bone densitometry can do. As maybe the best test is with visceral fat that they do with that. You can you can find about some internal organ stuff that could be very valuable. Size of your prostate, for instance, if you use particular types of imaging. So there's a lot you can find out, and that's different from the way we started out this program, which was the CAT scan, which does have a certain amount of radiation and is very specific towards a particular organ, in this case the heart arteries, and they are working on now and looking at the brain arteries too. So it's a different type of testing, more specific, more goal-oriented towards plaque. These MRIs are not looking at plaque. They're kind of more looking at your general anatomy, not getting to that level of resolution.
Yeah.
Got it. I just had a question for you, and
About the Book of You?
No. Well, because it's not to you. It's about visceral fat. Since you're... Well, it's more, I guess, because you don't deal with that.
No,
because you're
I have some.
You're a cardiologist.
Plenty.
Yeah, but so I wanted to know, like, what is, from your opinion, I don't know if that's like your field, because obviously there's different doctors for different things. What's the best way to lose visceral fat?
To lose, so it's losing weight. As you lose
weight.
Right,
but usually weight is distributed in certain places. Like I know people that they have bigger shoulders. Like that's where their weight gets distributed. Or I know like a girl that's like super skinny, but she has a belly, which is kind of weird for a lady because usually they go to the back and the hips.
Well,
So,
that's when you'd get that measured to actually see what their visceral fat is. So getting like a DEXA scan and actually measuring the visceral fat. But usually the visceral fat will start to go down once you start to lose weight. So the GLP-1s / help with that.
Regarding GLP-1s, for everyone watching, I've read a lot of articles and I've seen a lot of doctors that are saying this, that if you're on GLP-1s, because obviously your weight is being lost everywhere simultaneously. I've heard a lot of people saying about bone depletion and muscle.
Yeah. I don't think it's because of the drug itself. I think it's because the patient's usually not eating the amount of protein that they need
Absolutely.
to keep up that muscle.
So the question I have is, diet-wise, yes, I understand you need that, but what about the exercise? Because I've seen quite a few studies where because they're putting the pressure with heavier weights on the bones and on the muscles, it actually stops the muscles from depleting, or kind of like whatever the food comes in, it doesn't go everywhere, it goes more to the muscles and kind of preserves them.
Well, I think that's where you're eating the good amount of protein and then your resistance training. So if you're like overweight and carrying 300 pounds, then that's your kind of resistance training.
Just being alive.
So, but no, actually
Yeah.
working the muscles.
What would you say is the minimum to maintain the muscle mass without it atrophying? For just a general person.
It's
Yes, a general.
1 gram per kilogram.
That's for
of
the protein.
And then a couple of times a week, say like 3 times a week of some sort of resistance training.
Is there a minimum amount of resistance training to keep the muscles on? Or
Well, it
it's all
depends. It
individual?
depends if you're 70 or if you're 20.
Let's say 70. I'm asking you these questions because obviously there are a lot of, we're all getting older and a lot of people are on GLP-1s. And now my parents started taking GLP-1s. And I've spoken to a couple of my friends who are doctors and in their longevity. And the first thing my friend, Dr. K, said was, get your parents to start working out.
They need a trainer.
Yeah, and now I just see them deflating, and I see the skin hanging, and I see because my dad used to be a pro football player. His leg was like my torso, and now I just see him like shrinking.
Yeah.
And he's 72 now, 73.
Right.
And I'm fighting with them to like, hey, I'll come and I'll go to the gym with you. Let's do. If you don't want to do weights, I'll bring resistance bands.
That's
I'll
where
do
the
something.
personal trainer actually comes in and helps tremendously, because then they know the right type of exercise for that specific person and helps them along.
I've had a personal trainer for my mother and my father, well into their 80s plus, and that made more difference than any single thing that we did at that age, and they'd never done it before. So I would think that is the absolute best thing. I think there's also that capacity for socialization outside of their comfort zone, but the combination of which is unbelievably helpful in the elderly. It keeps them welderly, in my opinion. But I do think the GLP-1 story is just now being told. The GLP-1s now that we have are varied. They act differently. There's new GLP-1s. I'm lucky to be involved in a variety of research trials where I'm principal investigator on, and I am just shocked at the new types of GLP-1s that will be even easier for people to take and be less likely to have the kind of muscle loss that we're seeing. But she is right. Right now, the best thing you can do is good exercise while on GLP-1. Do not think that that's just a one-shot fix is all.
This might be controversial, and I can cut this out. But what about stacking GLP-1s with anabolic
Steroids.
peptides? No, peptides.
Yeah, there's that. I can tell you the new GLP-1s have new parts of them, new molecular capacity, but they're being studied at the highest level with the highest degree of rigor, well outside of animals, well outside of experiments. And the stack that you're discussing doesn't have that. So I would not recommend what people are doing now, which is experimenting with themselves. I understand where it's coming from because sometimes the research that we take takes too long. And so they're frustrated and they're like, listen, I have nothing to lose, but we do have a lot to lose. So I don't believe in people experimenting with themselves. It's just a trend right now. It's accentuated by social media. We're not for that. We're taking the cutting edge evidence and even evidence that maybe isn't fully baked, but not the stuff that just is experimental medications without indications that haven't had any real trials. There's too much to risk usually for the benefit. It's one thing if you're a cancer patient, you're stage 4 and there's nothing left to lose. If you're not that, don't experiment. Get a functional medicine doctor and talk. Keep your book of you around you so you know all the things that are where your baselines are and where you're going. So I think maybe with that, I'll wrap up the the session today, and really want to thank my amazing man on the street, our producer, Serge, that has done not only a great job of putting everything together, but is a fun guest to have and was able to bring in, I think, some of the questions that others have. And of course, Dr. Maklad for co-hosting today. And I wanted to thank everybody for watching us, our sponsor, Longevity AI, as well as I'd like to remind you guys to subscribe and tell your friends about us. And we'll see you on the next Soffer Longevity Podcast.